Chapter 1. A Momentous Discovery. The search for the fountain of youth, a quest that has captivated humanity for centuries, may have taken a significant step forward. Researchers have discovered that a common drug, metformin, used safely for over 70 years, can reverse aging in monkeys, marking a potential turning point in longevity research. Chapter 2. The Promise of Metformin. Metformin, the drug at the heart of this groundbreaking research, is not a new kid on the block. Its familiarity and proven track record in treating a prevalent chronic disease make it an intriguing candidate for anti-aging research. Chapter 3. Monkeys and Men. The recent breakthrough in metformin research stems from a study conducted on monkeys, specifically Cynomolgus monkeys, also known as crab-eating macaques. Their close evolutionary relationship to humans means that findings from monkey studies often have direct relevance to human health. In this particular study, researchers administered metformin to middle-aged monkeys for an extended period, carefully monitoring their health and cognitive function. Metformin not only appeared to slow down the aging process, but also seemed to reverse some aspects of aging in these primates. Chapter 4. A Familiar Face in Medicine. In the realm of medicine, where countless medications vie for attention, metformin stands out as a familiar face, a stalwart ally in the fight against diabetes. For decades, this unassuming drug has been a cornerstone of diabetes management, its name rolling off the tongues of doctors and patients alike with a sense of familiarity and trust. But metformin's story, much like its potential, extends far beyond the confines of diabetes care. Chapter 5. Decades of Diabetes Control. The 1970s witnessed a resurgence of interest in metformin, fueled by the growing prevalence of type 2 diabetes and the limitations of existing treatments. These trials demonstrated metformin's efficacy in lowering blood sugar levels, improving insulin sensitivity, and reducing the risk of diabetes-related complications. Metformin's rise to prominence was further propelled by its affordability and favorable side effect profile compared to other diabetes medications. Unlike some drugs that require frequent dosing and come with a laundry list of potential side effects, metformin is generally well tolerated. Chapter 6. Metformin's Multifaceted Mechanisms. Metformin's effectiveness in treating type 2 diabetes stems from its ability to target multiple pathways involved in blood sugar regulation and cellular metabolism. One of metformin's primary mechanisms of action involves improving insulin sensitivity, enhancing the body's ability to respond to insulin. Metformin helps restore insulin sensitivity, allowing cells to utilize glucose more effectively and preventing the buildup of sugar in the bloodstream. In addition to its effects on insulin sensitivity, metformin also suppresses glucose production in the liver, a process known as gluconeogenesis. Metformin acts as a brake on this overproduction, reducing the liver's glucose output and helping to normalize blood sugar levels. This dual action on both insulin sensitivity and hepatic glucose production makes metformin a powerful tool in the fight against type 2 diabetes. Metformin's influence extends beyond blood sugar regulation, impacting cellular processes involved in energy production and metabolism. This multifaceted approach is key to its success in addressing the complex interplay of factors that contribute to type 2 diabetes. Chapter 7. The Monkey Model. Our understanding of human biology, disease, and the aging process hinges on our ability to study these complex phenomena in systems that closely mirror our own. Cynomolgus monkeys share a remarkable 93% genetic similarity with humans, a testament to our shared evolutionary ancestry. This genetic kinship translates to a striking resemblance in terms of anatomy, physiology, and even behavior, making them ideal subjects for studying human health and disease. In the context of aging research, the use of Cynomolgus monkeys allows scientists to study the aging process in a compressed time frame. Chapter 8. A glimpse into the method. The groundbreaking research on metformin's potential to reverse aging in monkeys, conducted by scientists at the Chinese Academy of Sciences and Beijing Institute of Genomics, stands as a testament to meticulous study design and rigorous methodology. The researchers embarked on a comprehensive investigation, carefully considering every aspect of the study, from the selection of animal subjects to the duration of treatment, and the types of assessments used to evaluate metformin's effects. The study focused on a group of Cynomolgus monkeys, specifically selecting individuals between the ages of 13 and 16 years old. This age range corresponds to middle age in these primates, equivalent to roughly 40 to 50 years old in human terms. Middle age is a period when age-related changes begin to accelerate, making it an ideal window to assess the potential of interventions like metformin to slow down or even reverse these changes. The researchers employed a randomized controlled trial design, a gold standard in scientific research, to evaluate metformin's effects. Chapter 9. Finding the sweet spot. Determining the appropriate dosage of any medication is a delicate balancing act, a quest to find the sweet spot where therapeutic benefits are maximized without venturing into the territory of adverse effects. In the groundbreaking monkey study investigating metformin's anti-aging potential, the researchers grappled with this very challenge, carefully selecting a metformin dosage for the monkeys that mirrored the standard human dose. The researchers opted to administer metformin to the monkeys at a dose of 40 milligrams per 5 pounds of body weight daily. By mirroring the human dosage range, the researchers aimed to ensure that the monkeys received a metformin dose that translated to a comparable therapeutic exposure in humans. Chapter 10. Innovative monkey aging clocks. The quest to understand and potentially manipulate the aging process hinges on our ability to accurately measure biological age, a measure of an organism's true physiological age that can differ significantly from chronological age. In the groundbreaking metformin monkey study, the researchers recognized the importance of accurately assessing biological age, developing innovative monkey aging clocks to gauge the true impact of metformin treatment on the aging process. These monkey aging clocks, much like their human counterparts, are sophisticated tools that integrate data from various physiological and molecular markers to provide a comprehensive assessment of biological age. The monkey aging clocks developed for the metformin study incorporated a range of biomarkers, including blood glucose levels, cholesterol levels, inflammatory markers, hormone levels, and telomere length. If you're enjoying this video, please consider hitting the like button, share the video, and of course we would love for you to subscribe. Chapter 11. Unraveling metformin's effects. To unravel metformin's effects on aging, researchers employed tests to capture its impact on cognitive function, organ health, and cellular markers. Cognition, the ability to think, learn, and remember, often declines with age. Researchers assessed monkeys' memory, learning, and problem-solving skills. Imaging techniques provided insights into organ health. MRI scans examined brain structure and activity. Tissue analysis assessed cellular health and aging markers. Chapter 12. Metformin's impact on biological age. The holy grail of aging research is not merely to extend lifespan, but to enhance health span, the period of life spent in good health, free from the debilitating effects of age-related diseases. The recent metformin monkey study, with its groundbreaking findings, hints at the tantalizing possibility that we might be able to achieve both, potentially rewinding the biological clock and mitigating the decline often associated with aging. The study's most striking revelation lies in metformin's apparent ability to slow down, and in some cases even reverse, the relentless march of biological age in these primates. Biological age, a measure of an organism's true physiological age, often diverges from chronological age, the simple measure of time elapsed since birth. The researchers, armed with their innovative monkey aging clocks, were able to track changes in the monkey's biological age throughout the study, providing a nuanced view of metformin's impact on the aging process. the monkeys that received metformin exhibited a significantly slower rate of biological aging compared to their untreated counterparts, suggesting that the drug was effectively putting the brakes on the biological processes that drive aging. Chapter 13. Sharper Minds in Middle Age. Cognitive decline, often subtle at first but gradually encroaching on our ability to think, remember and learn, is a dreaded specter of aging, casting a shadow over the golden years. The metformin monkey study, with its intriguing findings on cognitive enhancement, offers a glimmer of hope, suggesting that this common diabetes drug might hold the key to maintaining sharper minds in middle age and beyond. The researchers incorporated a battery of cognitive tests into their study design, aiming to assess metformin's effects on various aspects of cognitive function in the monkeys. The monkeys that received metformin consistently outperformed their untreated counterparts on the cognitive tests, demonstrating enhanced memory recall, faster learning speeds, and improved problem-solving abilities. These improvements in cognitive function suggest that metformin was not simply providing a temporary boost in mental performance, but potentially influencing the underlying neurological processes involved in learning and memory. Chapter 14. A systemic anti-aging effect. Organ rejuvenation, a systemic anti-aging effect. Aging is often depicted as a relentless assault on our bodies, a gradual wearing down of our organs and systems that culminates in the frailty and vulnerability often associated with our twilight years. The metformin monkey study, however, challenges this bleak narrative, offering a more optimistic view of aging as a process that might be amenable to intervention, even rejuvenation. The study's findings suggest that metformin's benefits extend far beyond the brain, exerting a systemic anti-aging effect, revitalizing various organs and tissues throughout the body. The researchers, employing a combination of imaging techniques and tissue analysis, observed remarkable improvements in the health and function of various organs in the metformin-treated monkeys compared to their untreated counterparts. The hearts of treated monkeys, for instance, exhibited improved cardiac function, pumping blood more efficiently and displaying fewer signs of age-related stiffening. This finding is particularly significant, as heart disease remains a leading cause of death worldwide, often linked to the gradual decline in cardiac function that accompanies aging. Chapter 15. Protecting the Seat of Cognition. The Brain on Metformin. Protecting the Seat of Cognition. The brain, the seat of our consciousness, is the most precious organ. Its decline means losing our essence. The metformin monkey study offers hope, suggesting this diabetes drug might protect our brain from aging. Findings focus on key brain regions involved in learning, memory, and executive function. The hippocampus, crucial for memory, is vulnerable to aging. Metformin-treated monkeys showed increased hippocampal volume. Chapter 16. Metformin's Side Effect Profile. Safety first. Metformin's side effect profile. In the realm of medicine, where the quest for therapeutic breakthroughs is often tempered by the potential for unintended consequences, a drug's safety profile is paramount, its risk-benefit ratio carefully scrutinized before it can be entrusted with safeguarding human health. Metformin, despite its long and illustrious history as a diabetes medication, is no exception. As researchers explore its potential as an anti-aging agent, the question of its safety in this new context takes center stage, warranting careful consideration and rigorous investigation. Metformin, in the context of diabetes management, boasts a remarkably safe track record, with a well-established side effect profile, mostly gastrointestinal in nature and generally mild and transient. The most common side effects reported include nausea, diarrhea, abdominal discomfort, and gas, often subsiding as the body adjusts to the medication. These side effects, while bothersome for some, are rarely serious and can often be mitigated by starting with a low dose and gradually increasing it as tolerated. Chapter 17. A New Dawn for Age-Related Diseases. The specter of age-related diseases casts a long shadow over our later years. Heart disease, cancer, stroke, Alzheimer's disease, these chronic conditions take a heavy toll. The metformin monkey study offers a glimmer of hope, Could metformin emerge as a powerful weapon against age-related diseases? The study shows metformin's ability to slow aging and enhance cognitive function. It might address the root cause of many conditions, aging itself. Chapter 18. A Looming Crisis. Alzheimer's disease, a thief in the night, steals our memories, our identities, and ultimately, our very selves. It is a cruel and unforgiving disease, robbing individuals of their cognitive faculties, their independence, and their ability to connect with the world around them. For families, it is a heartbreaking journey, witnessing the gradual erosion of a loved one's essence, their light dimming with each passing day. Chapter 19. A Glimmer of Hope for Alzheimer's? Amidst the darkness of Alzheimer's disease, the metformin monkey study offers a glimmer of hope, a ray of light penetrating the despair. While the study was not specifically designed to investigate Alzheimer's, its findings on metformin's neuroprotective effects, its ability to enhance cognitive function and protect the brain from age-related decline, have sparked cautious optimism among Alzheimer's researchers. Could metformin, a drug already approved for human use, hold untapped potential for preventing or delaying the onset of this devastating neurodegenerative disease? The study's findings on metformin's impact on the hippocampus, a brain region crucial for memory formation and particularly vulnerable in Alzheimer's disease, are particularly intriguing. The researchers observed increased hippocampal volume in metformin-treated monkeys, suggesting that the drug might either promote the growth of new brain cells in this region or enhance the survival of existing neurons, potentially counteracting the hippocampal atrophy often seen in Alzheimer's. Chapter 20. The Road Ahead. From Bench to Bedside, the Road Ahead. The journey from a promising scientific discovery to a widely available therapy is often long and arduous, fraught with challenges and setbacks. The metformin monkey study, while groundbreaking in its findings, represents just one step in a much longer journey, a journey that must navigate the complex terrain of scientific rigor, regulatory hurdles, and ethical considerations before metformin's full potential as an anti-aging agent can be realized. The most pressing priority is to confirm the findings of the monkey study in humans. Animal models, while valuable tools for preclinical research, cannot fully recapitulate the complexities of human biology and disease. Therefore, large-scale, well-designed human clinical trials are essential to determine whether metformin's anti-aging effects observed in monkeys translate to humans. These trials will need to carefully assess both the potential benefits and risks of long-term metformin use in the context of aging, considering factors such as age, overall health status, genetic predisposition, and potential drug interactions. Chapter 21. Navigating the Longevity Landscape. Ethical Considerations. Navigating the Longevity Landscape. The quest to extend human lifespan and health span, while driven by noble aspirations to alleviate suffering and enhance human potential, is not without its ethical complexities. As we stand on the cusp of a longevity revolution, armed with the tools to potentially manipulate the very fabric of our existence, we must proceed with caution, engaging in thoughtful dialogue and careful consideration of the ethical implications of our actions. One of the most pressing ethical concerns surrounding longevity research is the potential for exacerbating existing social inequalities. Access to healthcare, already unequally distributed across socioeconomic lines, could become even more stratified if anti-aging interventions like metformin prove effective. The wealthy and privileged, with greater access to cutting-edge treatments, might further extend their advantage, widening the gap between the haves and have-nots in terms of both lifespan and health span. Chapter 22. The Dawn of a New Era. The metformin monkey study, with its remarkable findings, has ushered in a new era in aging research, one where the once fantastical notion of slowing down or even reversing the aging process is now a tangible possibility. This groundbreaking research, while still in its early stages, has ignited a spark of hope, a belief that we might be on the cusp of unlocking the secrets of longevity and transforming the landscape of human health. The implications of this research extend far beyond the laboratory, offering a glimpse into a future where aging is no longer viewed as an inevitable decline but rather as a process that can be potentially managed, delayed, and perhaps even reversed. The study's most compelling finding lies in metformin's apparent ability to slow down biological aging, shifting the trajectory of aging at a fundamental level. This is not merely about adding years to our lives, but about adding life to our years, ensuring that those extra years are lived in good health, vitality, and independence. Chapter 23: A Future Full of Hope and Challenges. The road ahead in aging research is long and winding, full of both promise and potential pitfalls. Armed with tools to manipulate our existence, we must proceed with caution, guided by scientific rigor and ethical considerations. The metformin monkey study offers hope, but realizing this future requires effort from scientists, clinicians, policymakers, ethicists, and the public. The scientific community faces the task of unraveling the complexities of aging. Understanding these mechanisms is crucial for developing targeted interventions. The metformin monkey study highlights cellular energy metabolism, inflammation, and oxidative stress as targets for anti-aging therapies. Translating findings into safe therapies for humans is complex and lengthy. Rigorous human clinical trials are essential to assess efficacy and safety. Trials must ensure participant well-being and address ethical complexities. Extending human lifespan raises profound ethical questions. We must consider social inequalities, overpopulation, and philosophical questions. Ongoing dialogue and collaboration are needed to align longevity research with shared values. The metformin monkey study offers a glimpse into a future where aging can be embraced with vitality and hope. The road ahead is challenging, but the potential rewards make the journey worthwhile. Let us proceed with wisdom, compassion, and a commitment to benefiting all of humanity. Thank you for making it this far. If you enjoyed or got value from this video, please consider hitting the like button, share the video, and of course we would love for you to subscribe. We also love to hear from you. Let us know what you think of this groundbreaking study. Please leave your comments below. Until next time, stay healthy, everyone.